Good afternoon, everyone. Today I'm going to discuss about this week clinical rotation journal assignment. This week clinical experience. During this week clinical rotation, I encountered a patient diagnosis with adjustment disorder, which was a meaningful learning experience for me. And the patient is presented with emotional distress following a recent life stressor, especially a job loss that lead to anxiety, low mood, and difficulty coping with daily responsibility. What stood out to me was how the symptom did not meet the full criteria for major depressive disorder or generalized anxiety disorder, yet still significantly impact the patient functioning. This helped me to better appreciate the adjustment disorder as a distinct and clinically important diagnosis rather than a middler condition. This experience deepened my understanding of the psychiatric mental health nurse practitioner role in recognizing the connection between the identifiable stressor and emotional or behavior response. I learned the importance of careful assessment, including timing of the symptoms and ruling out other psychiatric conditions. It also highlights the role of the provider in offering supportive therapy, psychoeducation, short-term intervention rather than immediately defaulting to the psychopharmacological treatment. I began to see how essential it is to tailor the care based upon the patient's specific situation and reliance factor rather than focusing solely on the symptom reduction. In reflecting on my strength, I found that I was able to engage therapeutically by showing empathy and normalizing the patient emotion response to difficult life event. This this appears to help the patient feel validated and less isolated. However, I also recognize the limitation in my tendency to want to fix the situation quickly, which could potentially shift the focus away from allowing the patient to fully express their experience. This made me more aware of the importance of being present and patient during the interaction rather than rushing toward the solution. For this experience, I gained insight into the therapeutic use of self, particularly the value of active listening, validation, and emotional presence. I learned that not all the conditions require immediate medication management, and the supportive care can be highly effective in adjustment disorder. Moving forward, I will apply this learning experience by focusing on patient-centered communication, allowing space for the patient to proceed stressor, and strengthening my skill in brief therapeutic intervention. This will help me build stronger provider patient relationship and provide more holistic care in my future practice. It was a wonderful learning experience. I look forward to implement each of the learning experience I have in a future practice to be a better provider and develop a strong patient provider relationship. Thank you.